What are possible urgent problems that may need to be addressed immediately at diagnosis?
So myeloma patients can present with a few emergencies. So that can include kidney failure. So some patients present with severe kidney failure where they're no longer able to, excrete the toxins that have accumulated into the body because their kidneys are failing. So that in some cases requires some urgent therapy like dialysis in the short term, at least, hopefully, until we can get patient diagnosed and treated to then try to rescue the kidney. So that's one example where patients may present with an emergency. High calcium level. Some patients present with high calcium level as a result of their disease. And in that case, we typically give a lot of IV fluids, and we may give certain medications to lower the calcium level that are done usually in the hospital, such as bisphosphonates and denosumab and things like that to kind of lower that level for them to not have symptoms from the high calcium, which are commonly there. They can also present with bone lesions, and these bone lesions can be fractures, or they can be essentially tumors of these plasma cells that are growing at any part of the body. We particularly worry about this near the spinal cord. So patients frequently present with back pain, and they may have a plasmacytoma, which again is a collection of those plasma cells. And in some cases, that can be pushing up against the spinal cord, which can then be at risk for causing injury and paralysis. So in that case, we typically want to diagnose very quickly, usually start patients on some steroid medications to help calm the inflammation down and kill some of those bad plasma cells, and frequently involve our colleagues from radiation oncology and sometimes neurosurgery, depending on the urgency, because we really need to address that area quickly to prevent some of that damage.
What is plasmapheresis?
Plasmapheresis is a way of basically filtering out some of these abnormal proteins out of the blood. It's similar to dialysis in a way, but what it's actually filtering out are these bad proteins. That is done in some circumstances still, particularly the scenario I described in somebody with kidney failure. And in that case, let's just say that's being driven by very, very high concentrations of these abnormal light chains in the blood. As we get patients diagnosed and started on treatment, sometimes that can be a very, very short-term way of clearing those proteins. If you just did that and did not start myeloma therapy, then that's not going to last very long, and it's usually not sufficient. But in some circumstances, depending on how high the burden is, we have done that for a handful of patients. But I will still say the most important thing is early diagnosis and then getting started on the treatment.
So when we think about myeloma emergencies for when someone is first diagnosed, two things come to mind. So the first one is severe fractures. And so, if the abnormal protein is affecting the bones, then it could cause pathologic fractures. And in more severe cases, this could happen within the spinal cord. And so if one has vertebral fractures, then there could be some neurologic damage if, this isn't treated in a timely manner. So if someone has bony involvement with pathologic fractures, it depends where that fracture is located and how close to neurologic damage one is at risk for. So typically this is a team approach, and so a neurosurgeon, if the bony involvement in pathologic fractures occurs in the spine, then a neurosurgeon might be involved to decide if there's intervention that's necessary for stabilization of the spine. Radiation oncology might be involved to see if there should be targeted radiation to quickly treat that spinal lesion. And then, of course, we're involved for systemic treatment to start. That would also eradicate that active plasma cell involvement and progression of the lesion. There's also a risk for renal disease, so kidney involvement. And so if someone has kidney failure, then that is something also that we treat as an emergency with myeloma. So with renal failure, the most important thing is just starting treatment as soon as possible. And so we would just start systemic treatment, whether that means that someone is admitted to the hospital to be started on systemic treatment for expedited workup. If it's started in an early manner, then oftentimes we can reverse this renal failure.
When is dialysis necessary?
So whether or not someone needs to go on dialysis, it depends how severe the renal failure is, how acute it is. And so a conversation with the nephrologist would be pretty important if someone has severe kidney involvement to decide if dialysis is necessary currently or if it's heading in that direction.
Why does myeloma affect the kidneys?
Myeloma can affect the kidneys for a couple of different ways. If the free light chains are significantly elevated, then they're excreted through the kidneys. And so within this process, they can become toxic to the kidneys and cause this condition called light chain nephropathy. And so this is one of the more classic manifestations of myeloma that's affecting the kidneys. If someone has very high calcium levels, which is also a manifestation of myeloma, then those high calcium levels can also affect the kidneys.